Endometriosis is a disease process that is found in females. The endometrial tissue that is like the endometrial tissue in the lining of the uterus is found in the pelvic cavity, on the uterus, tubes, ovaries, the uterosacral ligaments, the appendix, and even on the diaphragm of the lungs. I would say that endometriosis is a very common disease process, and the actual symptoms can vary from one small foci of endometriosis giving severe symptoms to having severe endometriosis and minimal symptoms. With some of our infertility patients, they have absolutely no symptoms, but yet have significant endometriosis. The most common symptoms are pelvic pain, painful intercourse, as well as pain with the menstrual cycle. It can occur in any age from post-puberty to menopause. The biggest risk factor is that it is a familial disease. If one family member has it, then you're at higher risk for developing endometriosis. One of the best treatments for endometriosis is childbirth. If you have a patient that has had previous problems with endometriosis and they're able to conceive, the placenta makes massive doses of a hormone called progesterone, and this progesterone burns the endometriosis out. So yes, indeed, pregnancy is probably our best treatment. The gold standard remains a diagnostic laparoscopy. That's a surgical procedure that's performed under anesthesia to actually make the diagnosis by looking at the pelvis and looking at the pelvic organs. Not only do you make the diagnosis, but you also treat it. Now, there are medical treatments as well, but personally, I don't like to use the medical treatments unless I know for sure that they have had a laparoscopically proven diagnosis. The medical treatments do have side effects, so you want to be sure that you're treating the right diagnosis. The studies clearly show that birth control can be helpful with endometriosis, particularly in teenagers. I think the first line of treatment for teenagers is that you would like to try a 3 to 6 month trial of oral contraceptives to see if it might help. You would want to see a doctor if the symptoms become a problem for you or become a problem in your daily life. The other reason that you would want to see a physician about this is infertility. Several people do not realize that they have endometriosis. They just, during their infertility workup, the last part of an infertility workup is endometriosis. You may not have any symptoms, but there's endometriosis present, and infertility is certainly a problem with endometriosis. If you feel that you have symptoms of endometriosis, please contact your physician to discuss the diagnosis and treatment options. We are more than happy to see you at Tanner Healthcare for Women.